guys, for today's mentoring minute, we're going to talk about lateral ankle sprains. We'll kind of go through a diagnosis and then also early acute rehab and then more like the chronic ankle instability. One of the most common things as far as musculoskeletal injuries, one of the most common things you're going to see in the clinic. As far as diagnosing it, a lot of it's done subjectively, right? Plantar flexion inversion, and then big things you want to rule out, right? Rule out ankle fractures. And you're going to have all this swelling, you have this pain, so look for pinpoint tenderness of the bones. Remember your auto ankle rules, pretty important. Anterior drawer, that kind of comes to 10 degrees, open back, right? Anterior glide, right? Potato tilt, stabilize the mortise. Invert right here. Invert. Looking for end feel, laxity, and pain. When we talk about syndesmosis sprains, we have bend the knee, dorsiflexion, external rotation. Dorsiflexion, external rotation. And lastly, we have the squeeze test. So, squeeze proximal, looking for reproduction of pain. Right? Palpation to the syndesmosis ligament. You got some, right? High sensitivity for high ankle sprains. For early rehab, right, acute ankle sprains, we want to use the acronym POLICE. So protected, so crutches, a brace, right? Optimal loading, right? Research shows that actually starting to walk on it sooner is actually better. And then the rest of that acronym ICE, ice, compression, elevation, right? Really control swelling, but actually start to load it as long as you're not increasing pain while you're doing it. Right? If we skip forward to more kind of subacute in the later stages, right, we want to look at contributing factors such as range of motion. A lack of dorsiflexion has been proven to be a high predictor of recurrent ankle sprains. If you think about it, dorsiflexion is kind of a closed back position. If we're not able to get to full dorsiflexion, it means we're kind of staying more in an open, looser path, like plantar flexion, and we're more likely to injure it. So one of the big tests they use is a dorsiflexion lunge test. So go ahead and step back with your right leg, right? And again, they do this normally against the wall, and you can either measure the angle at the ankle, you can measure toes to the wall, knee to the wall. There's lots of measurements. Right here, lunge forward, go as far as you can without letting the heel come up, and then you're just measuring that angle compared to the other side. Normal is about 40 to 42 degrees of closed back, single leg dorsiflexion like this. So we want to make sure we get into that. So we can do a lot of mobilizations. Early on, you want to avoid the distraction, right? Remember the ankle is it was a laxity injury, right? But later on, studies show that actually distraction is very helpful to kind of get patients back to getting normal range. All right, another one we want to look at is a STAR excursion balance test. So if we look at the STAR excursion balance test, so this is the modified, it's the Y test. It only picks out 3 angles. We'll do the anterior direction. So go ahead and stand on the involved leg and lunge forward as far as you can, keeping your heel down, and you can't actually touch the ground. You got to hover and come back up. Repeat that 3 to 6 times, depending on what study you look at, for practice, and you take a measurement. Okay? And then you compare it to the other side, the uninvolved. Anything larger than a 4 centimeter difference increases the risk of injury. And the other direction that's pretty important for ankle instability would be the posterior medial. So if we're checking the right leg, posterior medial will be going this direction. All the way back, try to stay in line with that tape, and back up. Again, practice a couple times, and then take a measurement and repeat it to the other. So you can look back at that tape. Do it one more time, John. Reach back, look back, reach. Good. Again, that tends to be the most predictive of ankle instability, especially chronic ankle instability. So we want to train that proprioceptive in control. Right? There's studies that looked at bracing and proprioceptive imbalance and found that proprioception imbalance training had a lower likelihood of re-spraining your ankle compared to ankle braces. Once you restore range, you've been working on balance and proprioception, right? You want to start to increase the workload to make the ligaments of the ankle and foot, as well as kind of the neural connections, be stronger to prevent ankle sprains. So again, single limb stance, great job, stand on one leg, right? Progress that to eyes closed, get rid of vision, right? Make your kinesthetic awareness, proprioception work way stronger. Then you can progress to go and open your eyes. You can stand on unstable surfaces, so like an Airex or a pad, Bosu ball, right? Again, now it's unstable, the ankle has to react. Right? You can progress to making things a little bit more sport specific. Right? So go ahead and stand on that, bounce the ball, you can bounce to the ground later. So again, you're doing sport specific stuff, So go ahead and bounce that ball back and forth between your hands. Right? If they're really good, they can progress to even closing their eyes, which is really tough on an unstable surface. So go ahead and step off there. Another method would be adding perturbations. So here I'll just have a TheraBand, stand on one leg, right? And you're kind of doing perturbations through the trunk. I can push him away, pull him towards, have to make his body react to it. Especially because he doesn't know which direction it's coming from. But you never really know when you're going back to sports. Thanks for joining us for Venture a Minute, guys. Remember, click the link below. It'll take you a direct link to PhysioU. You'll see the actual STAR Excursion balance test, the Y balance. It's the official one that goes through it. Again, want a big thanks to Jonathan and Lift for Change and Lift for Change here. And like it, share it, and we'll see you guys next time.